Imagine a world where everyone could receive vaccines, medication, mental health treatment, or even just a regular checkup. And imagine if getting the healthcare you needed didn't empty your wallet. In some countries, this isn't just a dream, it's a reality. And those countries are able to 1. Slow the spread of infectious diseases, 2. Reduce maternal and child death rates, and 3. Extend lifespans. The secret? Universal health coverage. As part of the United Nations global goals, all UN members have committed to achieving UHC by 2030. It's an ambitious goal, but those governments know that it's the right thing to do for their citizens and the smart thing to do for their economies. Yet today, at least half of the world's population lacks access to essential health services, and the cost of healthcare pushes about 100 million people into extreme poverty every year. This means that after paying for vital health services, they have less than $1.90 a day to live on. So why don't all countries have UHC? Lack of infrastructure, trained healthcare workers, access to vaccines and medication, and equipment. Because of this, people are often forced to travel long distances and spend large portions of their income on transportation. So they miss out on preventative care, like vaccines, and wait until their lives hang in the balance to seek treatment. But perhaps the biggest barrier to UHC is a lack of political will. It's a common misconception that countries have to be rich to provide UHC. In fact, some low-income countries have already made healthcare for all a priority and are setting an example for the rest of the world to follow. Still, 830 women around the world die every day from pregnancy and childbirth complications, primarily because they don't have access to health services. And 1.5 billion people suffer preventable neglected tropical diseases like river blindness and elephantiasis. So, what can be done? One solution is to inspire young people to be the next generation of healthcare workers and see the field as a viable career path. Frontline workers are key to reducing infant mortality rates, treating preventable diseases, and working on the ground during current and future pandemics worldwide. But they need access to tools and clinical training so they'll have the necessary skills and experience to treat people effectively. Johnson & Johnson has a legacy of supporting healthcare workers through education and driving innovation on the ground wherever it is needed most. To make the dream of UHC for all a reality, governments, non-profits, and businesses must work together to create and invest in robust health systems. Take action with Global Citizen and Johnson & Johnson to make sure everyone can get the health services they need, no matter who they are, what their income, or where they live.